I'm Dr. Meenal Parmar. I am from Jabalpur, Madhya Pradesh. I work in West Central Railway Central Hospital. I joined Dr. Kamini Rao ma'am's hybrid course, which consists of theory classes and along with it some practical classes, 15 days of clinical attachment and simulation training. It is a very helpful course because we have to work side by side in hospitals and we cannot take leave for 1 year, 6 months. So it is a very effective course. I have a 1-year-old kid also, so we cannot juggle our personal life and our hospital. We were given theory classes. Dr. Shantala ma'am taught us, and some classes were also taken by Dr. Kamini Rao ma'am. The most important were the basic classes, which are physiology and genetics and embryology, which were very important, and most of us have, we lost it during workings. So the theory classes were very nice, and 2 or 3 more people took the class and it was very good. In simulation training, we were taught about ovum pickups, how to do the IUI, how to do embryo transfers. Ovum pickups are very difficult part in IVF. Teaching about ovum pickup is a very crucial part. So we have been taught about it and it is very easy now. When 1 or 2 days we were very shaky and difficulty in doing ovum pickups, but now we are very much trained after 5-6 days course. So it is a very effective simulation training for ovum pickup. It will help me in patient stimulation, in how to talk to the patients, about how to be helpful to them, about the recent protocols, about recent guidelines, and how to perform IUI, IVF, ovum pickup in such patients. I'd like to thank Medline Academics and especially Dr. Kamini Rao ma'am for starting such a good hybrid courses for all of us people who are really working hard, not getting leaves and still want to do the fellowship course. Thank you.